Unfortunately, the virus is back with a vengeance. There's a significant increase in the number of people losing their lives to COVID-19 amidst this current surge.
Governor Pritzker today on the sobering reality we are now facing, a second surge of COVID-19. This one, he says, is worse on several levels. Unlike the first wave in late spring when healthcare workers were being praised.
Remember last spring when hospital workers were lauded with gifts of free pizza and cheers at the grocery stores and pots and pans banging in unison at 8 o'clock at night? Well, hospital leaders tell me that that's all come to a grinding halt.
Now doctors, nurses, and others are working longer, often double shifts. And Pritzker says too often he is hearing that people being hospitalized with COVID are being confrontational.
Too many people still seem to think that COVID-19 is a hoax.
To a large degree, he blames President Trump.
Since last spring, the divisive and misleading rhetoric of the outgoing President of the United States seems to have implanted a false narrative in the minds of a loud minority of Illinoisans.
Amid this second surge, the elderly made up a majority of deaths, including 47% 80 years old or older, 24% between 70 and 79. Roughly half of the state's COVID-related deaths have been linked to long-term care facilities. The state director of public health, Dr. Ngozi Ezike, says true, but much younger people are getting sick and dying too.
Of the 140 new reports of deaths that we've gotten, 2 of them were in their 30s, 3 were in their 40s, 9 were in their 50s.
And more COVID patients leads to greater stress on people seeking help for other ailments.
Cancer patients, those injured in car accidents, expectant mothers, victims of heart attacks and strokes. When we let our hospitals get overrun or even close to it, it is all of us who suffer.
And with the news coming from Pfizer today, Ray and Micah, that its vaccine is 95% safe and effective, the governor has said the state is ramping up its efforts for distribution on a mass scale when that vaccine comes to fruition.